Hello, Professor Reimer. I'm choosing to do a video because I am far too much of a perfectionist and a little bit OCD to try to do a PowerPoint. I was working on that. Wasn't going well for me. This is going to be my presentation. I am choosing to do chapter 9 of our handy dandy book. I have it right here beside of me. Chapter 9 is treating patients with substance abuse issues in integrated care. I am also going to discuss some mental health, depression, anxiety, comorbidity. I don't think I'm saying that right. I'm a little bit nervous because I've never recorded myself before for a presentation or anything, so I am a little bit nervous. Sorry if I ramble. That's why I have notes here. So if you see me moving around, that's what I'm doing. I'm looking at my notes to keep myself focused. Okay, so chapter 9 is treating patients with substance abuse issues in integrated care. Like I said, I'm going to talk about the chapter talks about substance abuse. It also talks about mental health issues. Primary care providers and behavioral health providers. So integrated care. So what is integrated care? Integrated care, the way that I kind of think about it, it's a combination. You take your primary health care and you integrate it with behavioral health care. And it's like one-stop shop, except it's for your health care, which makes perfect sense to me. And it's practical, especially for treating people that suffer from substance abuse and mental health issues, because these issues are most of the time, I don't want to say all the time, but in most cases, people have some sort of, if they have substance abuse issues, they more times than not have some sort of mental health issue, whether it's depression, anxiety, just general trauma, or more serious like schizophrenia, psychosis, and then, sometimes people don't develop mental health issues until they start using. We know that substance abuse does not discriminate, so it can be a complete normal person, or what you would assume is a normal person, can be affected by substance abuse or mental health. So why have integrated care? Why have physical, medical health care and behavioral health under the same roof? Well, like I said, it's practical. It's your one-stop shop. You go in, you have, you see your PCP or your primary care provider, and you have, you have back problems. You had an injury. You fell at work. Chronic pain, fibromyalgia, neuropathy from diabetes. You have MS, all, it's not limited to, just substance abuse. You have all these physical ailments that can lead to substance abuse because of the medication, which I'm going to talk about a little later. But the many services that can be put under one roof, along with it, is mental health. So you have the mental health aspect. So you have your behavioral health provider. Because oftentimes people go to their primary care doctor, because we've talked about this in class, because of the stigma that is associated with mental health. So I went to my PCP to get some depression and anxiety medicine. So oftentimes that is the first contact for physical ailments, mental health, substance abuse. If somebody is abusing or drug seeking, then they may go to their primary care doc and say, well, I've been coming here for a long time and I've been complaining about this. We've tried this, this, and this. Can we do this? And some doctors, because they've been seeing Bill for 10 years, then, well, I'm going to give Bill some Lortabs. And then Bill's been using opioids for, 5 years. And the doc never knew. So it's like a give and take. PHPs are trained to be able to, which, as our doctors, are, trained to tune into certain things. Certain, maybe flags, red flags. Substance abuse affects the body. It can cause liver problems, heart problems. The body with opioid use, the body does not tolerate pain as well, because it doesn't have to produce the natural painkillers that it makes. And once a person begins using opioids, they are not able to make the natural painkillers, because the brain rewires itself. So then it also affects mental health, because then if you're depressed and you are self-medicating from depression, then you are going to seek drugs. Sometimes, some people. This may be why they are drug seeking. If they suffer from anxiety, schizophrenia, bipolar disorder, several mental health issues. Alcohol is not, it's not just opioids, or there's alcoholism. Not everybody starts out using opioids. They work their way up. They may have started drinking when they were 12, and now they're 30, and they've, they have cirrhosis of the liver now, and maybe pancreatitis and stomach problems, and they obviously, we know that alcohol is a depressant, so now it's rewired the brain to where they're depressed, so they're depressed and they drink because they're depressed, and so it's just a circle. Mental health, I did touch on mental health and substance abuse are co-occurring. or comorbidity. I hope I'm saying that right. So one facility for your patient to go to get treatment, not only for the physical ailments, but also for substance abuse and for mental health. So you have all these services in one place for your patient to go without having to refer here and refer there and come to this specialist and go to this appointment. So you kind of cut out the middleman, because they're in the same office. They know they become familiar with that staff. They build rapport. They are able to, build relationships and trust. And the doctors, the providers, the nurses, receptionists, they're all able to build relationships with their patients. So they are more beneficial. They are able to see if Bill is having a bad day. What's wrong, Bill? And then they can pass that information along to whoever needs that information. Does Bill seem like he's in a little more pain today? Is he if it's a clinic for substance abuse, if the doctor is prescribing for substance abuse, is Bill feeling bad because he just dosed down on Suboxone or Vivitrol or methadone? Is that affecting him? Is this causing an increase in withdrawals? Is he having cravings? What's his support system? And with our book says that with integrated care in treating substance abuse, that the success rate is higher. So I personally believe that especially in this area is what we need more of. We have a drug epidemic going on in our little area, and it may not be a big deal in a bigger city, but we are in a very small area, and there are 7 to plus overdoses, usually by noon. And well, I gather that information from my mom. She counts them on the scanner, and from social media, the news. It's a pretty big problem. Well, you know that it's a big problem. And so if I'm not cutting on our clinics around here, but I feel that the clinics sometimes don't focus on what they need to focus on. I feel like they should be focused on their patient, and I understand they have to make money in order to keep things rolling, but I think there needs to be a little more. It needs to be a little more managed. You can't be on the same dose of Suboxone or methadone for 6 years. I think that it would be beneficial to our area. So then, our book talks about screening, because it mainly talks about the substance abuse clinics. So, screening, if you do have a patient that comes in and starts talking street slang. Well, yeah, I need some perks. I need some tags. Well, I took one of my granny's perk 10s and I felt great. I think there's an example in the book that talks about like the street slang. In my meeting people at work, you can usually tell within maybe 20 minutes of talking to somebody. You have to know like mannerisms. They're going to ask for stuff. They know what they want, and it works. And if sometimes it's not obvious. Sometimes it's somebody that really is in chronic pain. And they really may need the medication, but because of the epidemic that's going on, doctors are now afraid to prescribe medication. So the screening tools we've went over forever now not only assess for substance abuse issues, but they also assess for mental health issues. So if you are a primary care doctor, physician, doctor, then and you're the clients or patients first, contact, then the nurse always is the first one. Well, how are things? What brings you in? That type of stuff. So they're going to say, oh, I've been feeling down, or I'm hurting, or whatever their symptoms are. So then you can use the doctor. If it's integrated care, you're right there. He's going to come in, do what he needs to do, or she's going to come in and do what she needs to do, and say, well, I feel like maybe my BHP or my behavioral health provider that I have on site can come in and kind of talk to you about some things. Are you okay with that? So then, I am a behavioral health provider, so me coming in, that, given we were trained with the SBIRT, the Beck Depression Inventory, the GAD-7, the MDQ, the PHQ-9, the ORT, the DAS, the audit, the symptom checklist, 90R, which is like a 90 question checklist for mental health and symptoms and whatnot. Depression, anxiety, mood, alcohol, substance abuse. Those are all, as we know, excellent tools that we can use to assess and find out what's really going on. So then I've kind of touched on this throughout talking. The primary care provider's role. Well, their role, they provide knowledge to diagnosis. They provide us with insight on a patient. We may not get the primary health or the behavioral health provider may not get a referral the first time that the doctor sees them. It may be several visits, but the doctor has the knowledge, has the insight. The doctor knows the medical conditions. So what conditions are are they in chronic pain? Do they have osteoarthritis? Do they have fibromyalgia? What kind of what kind of physical ailments are do they have? Do they have any? And are these physical ailments the cause of a mental health issue or a substance abuse issue? Has this patient been on, Valiums since they were 23 years old and now they're 65? Is this person, 58 years old and bedfast and in chronic pain that has to be managed with large doses of opiate-based medication? We know that opioid use can lead to depression. It's hard on the liver. It can cause constipation. It has a lot of effects on the body. Are they being treated for depression using other medication? How do the medications interact with one another? These are all, this is all knowledge that the doctor knows. The doctor knows what affects and interacts with things. So then your behavioral health provider, your BHP, they have the knowledge of the mental health diagnosis. They are able to educate the patients about substance abuse, about mental health issues. They can educate substance abuse clients about relapse. Relapse is a potential that substance abusers fight daily. If they are committed to recovery, they fight relapse daily. They can share the diagnosis with the patient and explain it to them and educate them and talk to them and explain that they this is treatable. We can work on this. We can treat this. They can plan. They can help the patient plan for who their support system's going to be. Who do they live with? Who do they hang out with? Who do they have that is providing them support? Is this person healthy? Do they benefit them? What are they struggling with? Are they having a good day? Are they able to, how many times are they thinking about using? When are they thinking about using? Do they find their medication to be effective? Are they learning coping skills? Are they using coping skills? And this is all stuff that can be relayed back to the doctor. What medication is this person on that could potentially not fit well with that person, or the other medication that they're on to treat symptoms of physical or mental issues. This is all things that the BHP can be, asking questions and finding out. And the greatest thing is that I, as the BHP or whoever, I don't have to wait I don't have to call another office. I don't have to fax things. I don't have to sign requests. I don't have to sign releases. I can just walk down the hallway, get on my computer and IM, and say, Doc, this is going on. We need to address this, because the doctor is right there. So you cut out all the middlemen. You can help with discharging. Where are you going to live? Who are you going to live with? Again, it's all about support. What are you going to do? How are you going to handle stress? Let's have a plan. What plan of action do we have? How can we keep you from relapsing? How can we keep you from going back to the hospital? How can we keep you healthy? This is what it comes down to. How can we keep you healthy? There aren't many ethical issues because, like I said, I don't have to sign releases. I don't have to call and do this. I am with the doctor and whoever else is on the team. So there's no, I'm allowed. We're in the same office. This is our practice. So that's no ethical issues as far as that goes. Well, for the most part. So, in conclusion, integrated care seems like a brilliant idea to me. You have your one-stop shop for healthcare and for behavioral health care, in particular in Chapter 9, substance abuse care and mental health. They kind of go together. There's trauma, there's depression, anxiety, there's a vast array of issues that cause people to use. And there are, at the same time, absolutely no issues that cause people to use. And in return, people that use can develop these issues. The thought of having your primary care doctor and your behavioral health team in the same spot is beneficial for the patient. They don't have to go to 500 appointments. They don't have to travel 50 miles. Transportation is a huge issue for a lot of people. They don't have to worry about trying to get to 5 different buildings. They're in one building. It's ease of access for patients, and it's ease of access for the providers. We're in the same office. We are a team. This is our facility. I can talk to you at any time. I don't have to wait 3 days for you to call me back. And it's effective care. It's effective care. And to me, most importantly, I feel like it works. I don't know why people have not done this sooner. But we know it all comes down to money, and funding, and initiation, I think. But thank you for listening to my presentation. I hope that you enjoy it. I hope that it's what you were looking for, and it's been a really cool experience for my first time doing this, and thank you, and I will see you soon.